Chris Hahm is an Associate Dean for Research at the Boston University School of Social Work and the first Asian American to be promoted to be full professor at Boston University School of Social Work. Her work centers on health disparities, health risk behaviors, and mental health, with particular expertise in epidemiology, theory development, and suicide prevention among Asian Americans and US young adults. And on our panel, we have Aileen Lee, who is a clinical psychologist at BU Counseling and Psychiatric Services with a specialization in trauma-informed treatment. She has also worked in many therapeutic settings, supporting individuals with emotional struggles related to trauma, cultural adjustments, emotional struggles, and developmental issues. And our next panelist is Dawn Sauma. Dawn is the co-executive and clinical director of the Asian Task Force Against Domestic Violence, ATASK for short. With over 30 years in social services, she has supported Asian and Pacific Islander communities as a clinician, educator, and nonprofit leader. And our last panelist is Colleen Nguyen, who is a public health leader and community organizer and DrPH candidate at Tulane University. She currently serves as executive director of Asian Women for Health, where she leads community-driven programs focused on culturally responsive health education, workforce development, and mental health advocacy. So I'll pass the stage on to everyone and give you guys your mics.
Thank you. First of all, thank you for sticking with us, because when I come to workshop like this, after the lunch, I see half of the people are gone. But I see that it's still full, so this is a very good news and good sign for us. Thank you. So I am very honored to be a moderator for this wonderful panel, and I feel like we are going to learn so much, and their insight is going to be so valuable. So I'm very excited. So the first question that we're going to explore is the impact of our identities. So when I was preparing this question, I was going to just ask a question to our wonderful panelists, but I was inspired by Pata, for her being very open and, sharing the insights. So I wanted to kind of also talk about myself a little bit. So impact of my identity. So I was born and grew up in South Korea. I was 23 years old when I came to America. So I went to college, in Seoul, and I have all the family members still there in Korea. So I came here alone, and I only had one thing: the credit card from my dad. So literally, I didn't know. I mean, I came to graduate school. I went to Columbia University for the master's program, but I really didn't have anybody. Like, I didn't know anybody. I don't know how I came, to be honest with you. But anyway, I survived. And one of the things that I did was that when I was at the School of Social Work, I was working at the Queens. Okay, it's an internship. So Queens, right? Flushing Hospital, a Flushing area. It is incredibly vibrant and dynamic and very multicultural, right? So I was a student intern and dealing with a lot of clients and providing mental health services. And then I became a psychotherapist, and I was working at the Flushing Hospital and also at the New York hospitals as well. But then I have observed so many different kind of things. One of the interesting things that I found was that there was a really big conflict, intergenerational conflicts between parents and the children among Asian Americans. And because I was treating Asian Americans, Arab Americans, or white Americans, Black Americans, South Americans, South African, whatever, everywhere, from 64 different countries, whatever. But then Asian Americans, this conflicts, intergenerational conflict, really came alive. So I became very interested in that. So I wanted to, when I went to Ph.D. program at Columbia, I wanted to really explore this. What is the role of intergenerational or cultural racial differences? How that is impacting on individual and their families and their the adolescents' smoking behavior, sexual risk behaviors, and alcoholism. So that's how I started my clinical, and that clinical observation has had an impact on my research interest, and I'm still milking out of that. I fell in love with learning more about Asian Americans, but about my identity, I've been telling everybody that I'm a Korean woman for many, many years, for about 25 years. If anybody asks me, like, where are you from? Then I am, I'm from Korea and I'm a Korean woman. And then about 25 years ago, it has changed. Now I don't say I'm a Korean woman. Of course, I'm deeply Korean, very Korean, but I say I'm an American, Asian American woman. Because I have embraced, as I've been studying Asian American communities, mental health, physical health, impact, and political actions, I realized that, you know what, I'm not just Korean. I am an Asian person, and I'm an Asian American. So I want to be in this space that as an Asian American and as an Asian American researcher and clinician too. So that's how it has been impacted. But what I'm going to ask you is that, which I didn't talk about the challenges yet, okay? But I'm going to ask you guys, so how is your identity, for instance, your culture, the things that I've been talking about, your lived experiences or your race, how has that shaped your work, as well as what kind of things have been found as challenges that you're dealing with? Okay, who wants to go first?
Clearly me, because I've got the microphone. Now I've lost my train of thoughts. Oh, I was going to start with a couple of things. One, as you asked this question, as a woman identified Chinese, growing up in a very Chinese, I'm Malaysian Chinese to start with. Right now I'm an American citizen. So sitting up here talking about myself is a little awkward. And maybe this is also part of the work that we do in the end, is how do we embrace ourselves for who we are, and how do you slowly grow into that? I do not have a problem telling you how old I am, because I look like this. I am almost 50. So it took me 20 years to embrace who I am and how my culture shapes me to become the therapist that I am. When I first started my degree in clinical psychology, I was probably the only Asian face in the room. So it is a luxury for me to sit here with every one of you. So thank you for doing what you do. Thank you for aspiring to do what you want to do. So this journey doesn't become so lonely. And I think this is what it had been for so long in the beginning parts of my career. So, and in being alone, I think I slowly had to figure, and so in being alone and growing up in a culture where I didn't have to think about being Chinese, sort of gave me a certain luxury to not think about what it means to be Asian American or what it means to be anything, except I just came here to study. And as a Chinese person, somebody of Chinese heritage, and growing up with certain parenting styles and with certain anxieties, I needed to be perfect. I needed to get good grades. I needed to just learn. Being asked to speak up in class was not a thing. So I learned how to be quiet, I learned to challenge not to be quiet. And in the last many years, I find myself in a position where I'm so quiet because I don't think I need to say too much. But when I am saying something, suddenly everybody goes, oh, you've got a thought. It's important, wow. But then further on in life and in my career, it's like, great, I'm glad you think I got a thought, but are you gonna promote me? Oh, I'm sorry, you're not the right skin color. So those are my life experiences as I pass this on.
Thank you. So I don't know if I interpreted this question right, but anyway, so I think I was asked to kind of look into like if there are things that in my life that have sort of influenced in my culture and my, which influenced my sort of career moving forward. And so I thought there are many, but I thought of something early on when I was a young adult, which was not that long ago for anybody who's wondering, and it was I had the opportunity when I was a young adult to fill out it's like a census form or something that shared my identity. I was really excited about that. And I was asked to check. You had to check your box, right? You're instructed to select one box and one racial identity. I'm biracial, so I'm white and I'm Asian. And so what I did was I checked white and I checked Asian and I wrote Japanese right next to Asian. I don't know what they did with that afterwards, but that was sort of my way of unerasing myself within that space. And so it's sort of in those moments when I was realizing that, systems by design are exclusive. And so when I came into came into kind of as a professional, and I started to see the very same things when working with clients, and looking at seeing the rigid assessment forms and intake forms, and going, they don't fit into this. And looking at the language barriers and seeing how policies not only limited my clients that I was working with, but also me in the way that I was able to help clients. And so I guess moving forward, like how I think about this work, or how I think about me within this work, is that the importance of individual client care, but then also affecting the systems of the systems that affect that care at the same time, and making changes in systems. So that would.
Hi, everyone. My name is Colleen Nguyen. I guess when it comes to my identity, I identify as Vietnamese American. But I'm going to tell you this story because seeing it in context as to why I identify the way that I do, I think will then make a lot of sense. So when I was 19, one of my first jobs, while still in college because tuition is steep, was actually working for President Obama. So I had the wonderful privilege of traveling across the United States, meeting a number of people across the country in a number of towns across the country. Now, this is coming from a kid who is the daughter of refugees, Vietnamese refugees, grew up in San Jose, California, incredibly diverse, and just, jumping into these very, very small towns in America. Now, I had never experienced it until kind of like embarking on this journey, walking into a diner and everyone turning to look at you. And no one in that room looked like you either. So here you are looking at them, they're looking at you, and you're just like, listen, I just want like some pancakes, okay? I also speak English. Every once in a while they might ask you, like, wow, your English is so good. Where'd you learn English from? But I did that for 2 years. So I traveled across the United States and met a number of people, and it was wonderful in so many ways, in just being able to connect across our own humanity despite all of the different and varied lived experiences that we had had. But after being on the campaign trail for about 2 years, I think for me it brought a lot of reckoning in some ways, and really thinking about, I may identify as Vietnamese American, but it seems like the majority of this country sees me as Vietnamese, and I'm always trying to prove to them that I'm the latter, despite being born here. And so bringing that lived experience into the work that I've done over the course of my career, I think it'll explain itself as we kind of jump deeper into some of the conversation. But yeah, that's a little bit about me.
I think just your stories remind me of, my transition of identity. So I think one of you, I think it was Dorothy, I think you mentioned that, did you go to elementary school or preschool, like old Chinese school? Is it you? No. Somebody, is it you, Chris? Somebody said. Yeah, I did, yeah. Yeah, you did, right? Yeah.
It wasn't preschool. It was third grade because I didn't come to this country until I was 8. So
Okay.
you threw me with the preschool, but yeah, I did say that.
All right, so it's you, right? Yeah. So the reason why that remind me of my story. So I grew up in Korea, right? For 23 years, I was growing up as a Korean and living with people like you guys, most of you guys. And so I never had to think about racism. I never experienced racism. I never had to even question about who I was. one thing that I was feeling a little bit uncomfortable sometimes in Korea is being a woman. There is a hierarchy and there's a discrimination. But more or less, we're fine, you know? I just never really experience or ask question about who you are and why I'm being treated that way. So even when I came to America, for a long time, I didn't even feel it. I ignored them or I didn't feel it. I'm like a marching soldier. Like, you know what I mean? I am very confident. I don't care what you say. I'm like loudest one. Okay, even in America, okay? And then we moved to Boston and something hit me. Boston was different. So I lived in New York City and California and Boston. And I had a child each state. But Boston was really different. So, and I was studying Asian American experiences, right? And then it hit me, wow, this is racism. This is racism. And it was so painful for me. So let me give you one example. So my child was in elementary school. I was talking with this white woman, and we're like neighbors. Like she lives like in front of my house, literally. And I was talking with her, chatting with her, and then she said to me, "Oh, I gotta go because I'm busy, right? Yeah, I gotta go." So we chat, right? So I'm on my way, and then she bumped into another woman, and I'm driving now. She's been talking. I thought she was busy, you know. But then at the time, I'm sure it was not my first experience, and I realized that this is a racism. This is racism that I'm experiencing. This is a microaggression. And if I were white, or white has all the different people, right? But then, would I be treated this way? So I went to my office, go straight to my office, and I told my student, I was working on a paper, the impact of discrimination on Asian American women's health. And that paper I was not completing. It has been going on for a year. And then I told my students, we are going to finish that damn paper. And we finished within a month. So the reason why I'm saying is that when you are, within your groups, you don't know. But then I realized that it's so painful to experience racism. And then that also answered me, this is why the second generation mental health is worse than the first generation immigrants like me. It is consistent, not just Asian Americans. It's consistent, Black Americans, same. It's a Hispanic Americans, same. So as you progress generation to generation, you have to get better, right? By definition. But only people who get better is white. When you look at the socioeconomic status, it's the same thing. Korean immigrants, they don't do well. Koreans are doing great. Koreans are not doing well. Korean Americans are not doing well. Vietnamese Americans, a little bit better than Korean Americans. But we are more or less very much similar, the same. So what I'm saying is that the impact of discrimination is not minimal. It is so intense, so powerful, so real. We have to make it very explicit. We have to talk about this. We have to teach people about what we Asian Americans are experiencing. All right, moving on. Therefore, we are talking about the trauma-informed care, right now? And I wanted to ask you, so what is the, we talked a lot about trauma-informed care. We hear about trauma all the time, but we don't, sometimes it's more like becoming fashionable word to use a trauma-informed care. So what is the definition of trauma-informed care, and what does the trauma-informed care look like at your work, or working with your client, or your people you're serving?
I'm going to spin off from your story, right? In regards to trauma-informed care, I was trained very psychodynamic based. How that looks like today, 20 plus years later, is not sort of what we think about Freud. And if I think about integrating that into trauma-informed care and a lot of the topics that we're talking about today, it's very much, how do you ask questions, right? How do you take the stereotypes that we know about certain groups and learn how to just ask questions, not assuming that this is what your experience is going to look like, but as a way to sort of say, hey, I know about this. Can you tell me a little bit about what your lived experience is like? Did you experience this? Did you not experience this? What was it like for you? Trauma-informed care for me, over time, is a lot about sort of some of the topics we're going to talk about today: intergenerational trauma, class differences, like I work at CAPS, the Counseling and Psychiatric Services. I see a lot of international students. A lot of the Chinese students are very different from the Korean students, and then they're also very different from the second generation Asian American students. So it's a lot, and also what I've learned as part of how I grew up, we don't talk about feelings. Who talks about feelings? Nobody does. So what I do for trauma-informed care is, can I create a safe space for you to tell your story, for you to identify, name a feeling, shame, anger. I always joke about how we all have a very bad relationship with anger. Me and anger don't work, but you know what? Anger is powerful. Anger experienced correctly is safety. I built my wall, my appropriate wall, because my anger tells me I need to protect myself, right? Sadness asks us to go, hey, I need to talk to somebody about this. So a lot of the work that I do is like, here's your traumatic experiences. Let's put a feeling to it. Let's find a space to sit with this feeling and then work on coping skills to slowly slow it down. So that's how I look at trauma-informed care. It's long-term work. I'm not a short-term work kind of person, so yeah.
So we see trauma-informed care is recognizing that trauma shapes the way individuals see themselves, the way they see themselves in relationships, and the way they see systems. And so a lot of our work, what's central to our work at Asian Task Force Against Domestic Violence, is culture and language. Because the primary population that we serve and the population that we specialize in are Asian, limited English proficient survivors that are often first-generation immigrants and refugees. And so we're reminded of the importance of this in many, many ways all the time, and I'm just gonna give you one example of how we were reminded once again. And so over COVID, we were inundated with calls from people who needed help. And so one language in particular was just getting so many calls, and we had 2 advocates, and they were just beyond maxed capacity. And so we had to do what other people do in a regular sort of setting, which is we would triage to an advocate that didn't speak their language, and we would use an interpreter. And so we thought, okay, that would work, that's temporary, and that's a temporary solution. Later on, as things started to sort of slow down, we were able to transition those clients over to the Vietnamese advocates who spoke their language. And what we found out was that they were not comfortable disclosing to those advocates. And so we didn't know how high risk they were. And that was a huge red flag for us. And it was a big reminder that even our best practices in thinking about using interpreters aren't often best practices. And so when we think about trauma-informed care, we're really thinking about making sure that services are provided in a way that is meaningful to the client and that fosters trust, because those details and getting to those details really matter.
Yeah, and I think I'm going to build off of what Dawn shared, because I think at Asian Women for Health, it's a similar approach, which is really, in public health, you're going to hear a lot about, like, we need to meet people where they are. But what does that actually mean, right, in practice? And I think for Asian Women for Health, it's really more about thinking about the procedural aspects of it. One of the programs that we have is a peer leader program that's actually led by Kat, who's in the corner over there. So full credit. And it's really this community space and program focused on youth development, but also the intersection of those who identify as LGBTQIA2S+. And so when you're considering these spaces, some of the things that you should be thinking about, especially in the context of trauma-informed care, is ensuring that there's clear consent, that it is more of a collaborative effort than prescribing anything. It is about co-creating versus telling people what they need. And I think ensuring that people have a choice, decision-making power, autonomy is incredibly crucial in ensuring that these spaces are not only made by those with lived and living experiences, but they truly are for them as well. So.
I think it's really interesting that you said that, in your work with youth development, co-creating and decision-making and giving them responsibility and working together. I think that sort of practice is not really what Asian Americans are used to because of the hierarchical, because of ultimate respect and responsibility that you may have, toward your elders, your parents and things like that. So, we are struggling in a way that there's intergenerational conflicts, right? Which I talked about in the beginning. We are struggling, although there's such a beauty of that culture, but at the same time, when it comes to working together, like horizontally, I mean, that's something that we feel really comfortable with. So I wanted to ask you, what kind of things that you observe and how do you settle those kind of tension in your work? Well, what do you observe among the Asian Americans, intergenerational conflicts, and because of those kind of cultural issues?
I need to not start again. Before I actually answer the question, I'm listening to Don and Colleen talk, I'm listening to what you're saying, and I'm sitting here thinking to myself, it's like the four of us are coming into this conversation from very different perspective. Like, you have your research, I have my individual practice, and both of you work at the community level. And it's like, how do I answer my question to sort of pair up, right? Because I feel like in your question, intergenerational dynamics, it's like, in individual therapy, it's like, let's talk about this. Let's just keep talking about this. Let's identify it. Let's figure out, how you can survive in this environment. How do you create a new, different meaning? I will never tell my clients, especially my AAPI clients, to talk to your parents about this. If I don't talk to my parents about how I think they're annoying, I'm not gonna tell somebody else to do this. And I have people come back in and say, it's like, oh, the therapist that I was referred out to the community say, have you talked to your mom about this problem? Do your son talk to you about your problem?
Their problems?
Yeah,
they actually do.
lucky.
And I only have boys.
So I think it's hard. It's one of this question is like, right, if I tackle it on an individual therapy level, it's gonna look so different from what you guys have to do. Like, I would say, you know what? At the end of it, it's like accepting that your parents are not gonna, your parents had a whole set of life experiences that you may never understand. And yes, they may have contributed to your trauma, but at the end, if you're calmer, if you are not so entwined, like, you can take the step back. You can actually say, just give me 5 minutes, and then kind of brace yourself for their like, bah, 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 and then you can walk away. And once you're calmer, you can come back, and of course you apologize. For some of us, we'll say, I'm so sorry. I'm so sorry. So that's me on my individual level.
So of course my lens is through my work, and so a lot of victims who come through us come through with a lot of strong family expectations around keeping what they're experiencing at home silent and keeping it within the family. It's something you don't talk about outside those walls. And there's also this expectations from the older generation about endurance. You can endure this, and don't dishonor the family. And then you have younger generations that are pushing for help-seeking behavior and leaving. I'm echoing. And leaving. And so oftentimes the victims that we see are caught in the middle of this, and that intensifies. I don't know where to put this. I'm not trying to. It's like echoing. It's intensifying feelings of shame and guilt, and increasing feelings of mental health and wellness, feelings around their own wellness, and so. Our advocates are at the front lines of this, and they're not clinicians themselves. We do have clinicians on site who provide supervision and oversight and guidance, but they're not clinicians themselves. And so the way we approach this work, really, because we are working with victims of trauma who may not want to seek mental health services because they're not crazy and they don't want to be told they're crazy, is how they feel about it. And so really, it's conversations around one, around sort of reframing what counseling can look like, reframing what wellness can look like, and it doesn't have to necessarily be counseling. If that is your interest, then we talk about things like, what would your rights look like in the context like that? You have the option of choosing your therapist and choosing again if you want to. And then we also think about it through since our advocates or our frontline staff really are on the front lines and the first person to hear about their story at the most intimate level in the most intimate time, and they often don't want to share that again. So they do become the first trusted source, and they do become the person that they share their feelings with. And so the way that we do this, though, is because we have staff that can speak their language and understand their culture. And so we have 15 advocates. We have about 20-plus frontline staff. Collectively speak over 20 Asian languages fluently, and are often first-generation and survivors themselves. So we really focus and try to center our work on making sure that we represent the community that we serve.
I think in our work at Asian Women for Health, it's similar to Dawn's work, I think, just at the community level. But some of the things that I have personally seen has really been around silence and stigma, even though I know some folks in the room may not like that word. I think in the cultures themselves, there's sometimes the sense of everyone has a role. You're here to play your role. And sometimes you have 5 roles, but it's very hierarchical. And so, even for me in my own lived experience growing up second generation, I couldn't talk to my mom about feelings. Like when you're talking about, a therapist telling you like, oh, maybe you should talk to your parents about this. Yeah, no. Like, in 8th grade, here's the story. In 8th grade, I tried out for the girls' basketball team because I was, I like sports, pretty athletic, short kid but can shoot, kind of like Steph Curry, but not really. And I went for like 2 tryouts, had a great time, came home. My mom says to me, listen, I need you to come home and take care of your sister. So you need to make sure she does her homework. You got to feed her. I can't have you out there playing basketball till like 5 or 6, and then you're coming home and doing your homework? No, I need you to come home. And I think I argued with her for a little bit and was like, all right, fine. All right, got to get home. So I didn't show up to tryouts for the rest of the week. The problem is that my coach found me. So then he corners me at school and he's like, hey, haven't seen you at tryouts. We'd love you to have you on the team. Do you want me to talk to your mom? And I'm almost certain I said to him, looked him dead in the eye and was like, Coach Thomas, do you want me to be dead? No, please don't ever talk to my mom. But that's kind of the dynamic kind of endures. I think in my generation, we make jokes about it. Like, hey, did you remember when your mom or grandma used to do like this? And you'll see these memes on like Instagram and TikTok and things like that. But it's so real. It is so real. And I will say that I still see remnants of that in younger people now. But as the generations become farther removed from that immigrant experience, you'll see different variations of it. It's not exactly the same, but still similar, kind of like emerging themes.
So in my research, I studied immigrant Asian Americans, right? And particularly Asian American women. And what I wanted to really discover was that why Asian American women are suicidal, why Asian American women have higher rates of depression. So we were doing quantitative and qualitative study, and we were analyzing the qualitative study, and I have discovered this theme, these characteristics of parents that women were describing, but these women were suicidal women. So what we found was characteristics, 5 characteristics. It's like ABCDG parenting. So A is abusive, B is burdening, C is culturally disjointed, D is culturally disjointed, D is disengaged, and G is gender prescriptive. So I was giving a lot of talk about these 5 different characteristics of this disempowering parenting style. And then I was getting some questions. Okay, does that mean that you're blaming on Asian American parents? They work so hard, they sacrifice all their time and all their lives. They came to America for children's education. They don't even buy clothes. They wear like same shoes for 8 years. I hear all these kind of stories. So all right, so I went back to my lab and you know what? We're gonna have to do more work. I said to my students, let's really try to dig in and let's see who becomes ABCDG parents. Who becomes disempowering parents? And what we found was that these disempowering parents who ultimately lead to Asian American women's poor mental health, they had the characteristic too. Oftentimes, they had their mental health problems. They had physical health problems. And despite of their socioeconomic status, they had so much work stress. But then this work stress came from discrimination experiencing at work. Even though they might be doctors and lawyers, they're not being promoted. They're like middle range, They're not a CEO, for instance, even though they went to, Harvard or Stanford. I don't care what they are. So regardless of this, socioeconomic status, parents are bringing these stressors to the families, to the daughters, to the children. And about the silence, these women, they really didn't know about their parents' prior history before they came to America. They didn't know about their grandparents' story. Jewish people, they talk about their ancestors all the time, right? There's something called the Bible, okay? So they study Bible. They talk about Bible. They talk about the histories over and over again. But for Asian families, they don't have that. They don't have the books. They don't teach about the Asian American histories. They don't talk about what the grandparents, amazing things they have done. They don't. So it is impacted by all those kind of factors. And those factors are not something that we cannot ignore, because those factors are literally directly impacting what kind of parents they become, and that there is subsequently impacting on their children's mental health. And that is also impacting the next generation mental health. So really recognizing this intergenerational path. And so what we need to do is we need to be aware. This is what the knowledge becomes a power for us. We need to be aware, and then we need to break the cycle. We need to break the cycle. We should not be ABCDG parents. And how do we do that? We have to understand those factors, like what kind of factors do we have? Are we silencing? Do we have mental health issues? Do we have physical health issues? we have to address them. That's the only way that we can break the cycles. Okay, going forward, the next question. So, wanted to talk about in this forum, wanted to talk about how our identity impacts our work, and the definition of trauma-informed and the intergenerational aspects. Another really important thing that we need to talk about is what is that called? Intersecting identities, intersectionalities of identities. So intersectionality of identities, especially I wanted to talk about LGBTQ issues. So one of the paper that it just came out, I published with Dr. Brian Kuhn, is that, so Dr. Kuhn, if you remember the one of the table, the figure, you saw that Asian American suicide rate was going up, right? So the study that he was showing was the earlier study than what we published. So for the last 12 years of work that he, the data set that he generated, and yes, it has gone up. It has gone up. Female, male, it has gone up. But our study was published in Journal of Adolescent Health this year, was that, okay, let's not just look at the gender. Let's look at the intersection of their LGBTQ issues. So we grouped 4 groups. One is Asian American female, okay, heterosexual. The other one is Asian American female, LGBTQ, male LGBTQ, and then male heterosexual. What we found was that for the last 12 years, yes, it has gone up, but then when we enter the intersectionality of gender and sexual minorities, actually the heterosexual groups, male and female, is flat. The suicide didn't change. The suicide rate didn't change. It was driven, the increase was driven by the LGBTQ status. So given this, it is so critical for us to understand this intersectionality and really recognizing special population and providing services and the treatment and designing the services and treatment for this, this particular group of the people. So I was wondering about how that intersectionality is you're addressing those intersectionality issues at your work. Okay, we can change it around a little bit.
Yeah, I guess I can go first. I'm trying to figure out just where to start. So I think for me, like I said, one of the programs at Asian for Health is really trying to create these youth development and peer leader spaces for those who have intersecting identities of, identifying as AAPI as well as LGBTQIA2S+. And I think, the first thing that comes to my mind is, if the question is, why are there higher suicide rates for those of intersecting for those of intersectionalities, to me it makes sense because you're looking at marginalized communities within already marginalized communities. And the more layers that you add upon all of that, obviously gets a lot more complex. I also think that playing into, let's say, the individualized or personal struggle of those intersectionalities are the much larger systems that exist, the dominant narratives that exist. And these narratives are some that do become internalized. And they become internalized at a very young age. I say this to also share, I'm all about stories today, I don't know why, to share about my son. My son's 5. He is biracial. He also is neurodivergent. Probably gets it from me, truthfully. And the other day, he was really struggling with impulse control. And, you know, he's 5. I don't really expect much from a 5-year-old when it comes to, don't grab that piece of chocolate, please. And we know that he has, like, his brain works differently. And I remember he grabbed, like, a piece of candy or whatever it was, and I said to him, like, I was like, Zachary, why did you grab that? I told you to just wait, like, 2 minutes. And the first thing he says, well, the first thing he does is drops it, and he says, I'm a bad kid. But here's the thing. At school, and I've seen this happen to not just him, many other children, right? Which is like, the teacher's gonna come up to you and be like, I need you to be quiet, shh. And you're just struggling, you're sitting there and you're struggling, you can't figure out why you can't be quiet. Why can't I be like the other kids? But you don't have the words to articulate it yet. And I think, you know, for me, my fear is like, he's 5, he's already identified this about himself. Oh my God, is he really gonna internalize this for the rest of his life? And when you talk about intersectionality, that's what I think of, is that these much larger dominant narratives that exist on, this is how you're supposed to be. This is what society values. How can we not expect, you know, more mental health challenges if there are certain things that are expected of us and these systems aren't built for us? In our work, we're really trying to change that. At least I would like to think so. I think, and maybe this is bold, I think that the existing models of care that exist within mental health care, because they're not built for us, aren't really the right answers for how we should be addressing our own mental health challenges and well-being. I think that in order for us to truly tackle this head-on in a way that is equitable, representative, and effective, it's got to be built from the inside out. And I think it's going to start with us and our communities, which is why we've, at least at Asian Women for Health, we've invested so much in our youth, because I really do believe that the answers will come from the younger generation as we pull this together. Now, I'm completely biased because I'm a community organizer. I am not a clinician, although I've been in many years of therapy, decades of it. And I think for me, you know, that's where the answer seems to be. I don't think it exists yet. I think it's going to be made. And I think we're going to watch it be made over the next 10, 20 plus years as we, as younger people, step into this and hopefully take this back to build something else.
Well said. Okay, it's hard to follow that. But when I thought about this question and intersectionality, I thought about culturally specific organizations, because that's the lane that I'm going to stay in today, and ATASK. And oftentimes culturally specific organizations, especially when you serve an LEP population or a limited English proficient population, is expected to be everything to everyone, because there isn't anything else. And so that places a heavy burden on our staff. It places a heavy burden on our capacity. And so the clients that we serve, and we're a grassroots organization that started over 30 years ago, but the clients that we serve are Asian, limited English proficient victims of trauma, and who are often either not served or poorly served by mainstream organizations. And so we've become very recognized for the amount of languages, because we put such intention in this, because there is such a big gap in our current systems and our mainstream systems to be able to serve limited English proficient Asians. And so we put a lot of effort into making sure that we had as much staff possible to serve this population. So we do have that 20 plus Asian languages, which you're not going to find anywhere else. So we're called upon not just to serve victims of domestic violence, but victims of sexual assault and human trafficking, and those from the LGBTQ plus community and elderly, and all of these of which we all want to serve. and do well. And so, but we recognize our limitations at the same time, so we're very big on partnerships, and we have great partnerships with sexual assault organizations, with human trafficking organizations, with LGBTQ IA+ organizations that partner with us, and disability advocates and faith-based organizations. So we really center our work that way on partnerships because it can't be everything. So collectively, we're able to do the work together.
That's a lot of work. Good for you.
Yes.
I'm gonna tell a story. I'm not gonna disclose too many information. I work with a transgender male. I've been working with this individual. This individual is in the mid-20s now. I've been working with him for 10 years. Came to me as a client, ADHD, depression, South Asian, highly educated parents, the stereotype in the STEM in the STEM field. They're very open parents, as our stereotype goes for immigrants, right? So they came to me. One of the things very interesting about working with AAPI, at least with the older generation, is I'm always the expert. Okay? And now that I have a DR in front of my name, I'm more of an expert. So there's a little bit of value in my expertise and my authority, because there are certain things that I am allowed to say and that will not be rejected. So, but part of my work in the end also becomes I have to pay attention to facial expressions, right? If I say something and I see a certain look on their face, and I was like, okay, I need to talk about this. So my advice is not just, you gotta do this. I'm gonna tell you, and we're gonna figure this out. Coming back to my story, many years after talking through the depression, decreased SI, neuropsych testing, ADHD meds implemented, 3 months in, my client comes in and says, I need to tell you something. And that's when the conversation around his gender identity came up. And I'm sitting there going like, how did I miss this? You have been with me for 6 years and I had no idea. So then we talked about it, he starts to tell me about his experiences. And we've gone through a whole bunch of things. And finally, it came to the moment of the conversation around hormone therapy. And he's still underage. No, is he? No, he's still under his parents' insurance. And his parents are still very involved, don't get me wrong. They're really good, engaged parents. So I'm like, okay, now we're gonna have this conversation about how you think you want me to tell your parents, how I think I need to tell your parents, and I don't know, good luck to all of us. So luckily, the parents liked me, and so I brought them in, and I delivered the message with the client in the room, and I waited, and they both looked at me, and I looked at my client, and this was also pre-planned too. I was like, do you want to step out now? And he's like, okay. And then the minute he left, the two of them had so many questions for me. They just had questions. I got lucky. I got lucky because this set of parents were educated. They were hearing about all these things over social media, so they know. So therefore, they came with questions. So my job in the end was to answer questions, remind them that it's okay to not know, remind them that this is not a right or wrong scenario, and also remind them the constant reminder that as your therapist, at this point I feel like I'm the family therapist. As a family therapist, my job is we're gonna get through this. We're gonna get to the other end where you're more comfortable. So I think, and sometimes it's like I say, my work is like very in there with individuals, with their stories, trying to figure out, how do we get to where you're a little bit more comfortable? How you can be, you have more answers now. And if you don't have an answer, where can you go to get answers? That's where the resources all come in and such. So.
Yeah. Thank you. It's a really complex landscape that we are navigating. You mentioned a little bit about the social media, so I wanted to ask you a question about telehealth. You know, telehealth like blew up after COVID, during COVID, and we're still utilizing telehealth. Telehealth can be really convenient. You know, you don't have to spend like 30 minutes, an hour a day to go see your therapist. You can just turn on the Zoom. You can do that. Now, social media is impacting everybody. Everybody. I haven't checked my Facebook for a while, so I feel good, actually. But AI, you know, so many people are relying on AI for psychotherapy. And you read more and more from the newspapers about these young people, not only young people, but there are some cases of young people having deep, deep conversation about their mental health distress. And, you know, ChatGPT is, sometimes it's good, okay, but then sometimes they don't give you good advice. They didn't go to social work school, they don't have a licensed psychologist, and they don't even acknowledge or they don't even notice the delusional symptoms. So most recent case in Connecticut, you heard about it, right? This man, I think he's like 50 years old. He had a long conversation with, this ChatGPT about his mental health concerns. But then ChatGPT said, you have no problem. Your concerns are all legit, basically. And he ended up killing his mother and himself. So there are still, investigation is ongoing right now. So technology, mental health, and clinical work, those became inseparable, right? So we are dealing with these ethical issues, like, you know, what is an ethical thing to do? I'm sure OpenAI, all this, they are hiring a lot of psychiatrists, I'm sure, to deal with this situation. But then my question for you is, how are you dealing with these complex technology issues at your work? Do you use technology? To what extent do you use technology? How has it been helpful? Any kind of ethical dilemmas that you are having? Those kind of things.
This is going to be an ongoing joke between the two of us now. When I read this question, I was like, how can we not use technology? It is all over the place. It's like, I feel like being not young, not old. Like, I recognize that we need to just follow along the trend, right? Whatever the trend is out there, we need to be aware. We need to be knowledgeable around it, especially working with young people. And just Colleen, you were saying earlier about you believe the next generation are the people that, can likely make changes. And I agree. One of the reasons why I love working with the college-age population is that this is a place where I know I can find out what it is that you all know. I'm still on the older side with a little bit more wisdom, and I may be the devil's advocate in whatever you read in social media. My favorite things will always be, I come in with an intake. It's like, oh, I saw on TikTok yesterday that I checked off on the checklist for ADHD. I think I have ADHD. And I was like, okay, I'm so glad. Thank you, TikTok. So tell me about your symptoms. Check. No, sorry, you're not that hyperactive. No, not that one. Yeah, I can see why you're distractible, because if everybody else is talking around you, how do you pay attention? And if you my favorite, I'm sorry if I'm gonna offend somebody in here. Oh, I'm procrastinating. I'm like, why are you procrastinating? What are you procrastinating on? So I asked for information. And it's the really boring paper that is due tomorrow that they know about 10 days ago and refuse to start it until, I don't know. And so in their minds, right, people are like, oh, I'm a procrastinator. I am distractible. I have ADHD. I have anxiety. And how technology is very informative. It allows the person to come into my room with their concerns and their questions. I thank them for using technology. However, what I do is like, all right, let's break this down. Tell me your story. What is it? So eventually we get down to, no, I'm so sorry. You are just anxious, and here's why.
Okay, so we use technology in a variety of ways in our work. And I think one of the most, a pivotal moment for us was over COVID, where we're trying to figure out, like, how do we serve victims remotely? And we're a statewide operation, and so this is all across the state that we're trying to figure this out. So we turned things around really, really quickly. Our shelter stayed open, and the reason I'm pointing over there is because I have 3 shelter staff here. But our shelter stayed open, never closed, but our direct services did. We didn't have a choice. And so we outfitted people with laptops. They had cell phones already. We got Zoom. We had DocuSign. We had everything you could possibly imagine, and switched things over as quickly as possible. We found out that this actually worked really well for us as a statewide operation. It allowed us to reach more people. It greatened our reach. It made us more efficient. So that's one way that it's worked for us. We also use social media a lot, and our website to share information and resources to the community. So those are a couple of ways that we use social media and technology.
Yeah, I think similar to what Dawn was talking about in regards to scheduling a Zoom appointments, getting on Zoom, being able to talk to any of our peer leaders within our programming, incredibly helpful from an accessibility standpoint. But I think for me, when we talk about technology, you have to think about who doesn't have access to that and who doesn't have access to privacy. Oh, I'm sorry. And I think for me, when we talk about who does and doesn't have access, we know things like on social media, I think like the majority of people on formerly Twitter, now X, is like 80% white, highly educated, has access to internet, knows how to use it. And so when I'm thinking about how do we actually really reach out to those who may need our sources, our resources, our services, I'm also thinking about we need to kind of develop a 2-pronged strategy where part of it is, yes, online, and that's where you're going to see a lot of information, but the other part is also that sort of grassroots approach to actually being in the community and talking to people, sometimes knocking on doors, sometimes saying, hey, I'm going to be at the farmer's market where people actually gather on a Sunday morning or get their groceries, and have some of these conversations. I think in relation to AI, because I know that's a hot topic now, and it's funny because Dawn and I were just talking about this over lunch. There are a lot of companies out there right now who are developing this technology and utilizing this technology, which, by the way, was built off of our information that we shared with them. It's, communal here. That don't care about the ethics of who's at the table and who's not. I think if we are to be responsible about it, whether it's developing, an AI technology that will address certain mental health diagnoses or even utilizing it as a tool within this context, people lived in living experience need to be at the table. And I also think that there is a responsible way to go about doing it. It's whether or not the people in positions of power and have control of the policies and these systems are willing to give some of that power up. I also think, because I do believe in responsible AI, I also think that if they were to go the more ethical route, they're going to come out with a much more powerful product than they could ever build without us.
Mm-hmm. Scary world is coming. I feel like greed is a problem. Greed. Yeah, technology company, they want to continue to have more power and monopolize the money, and they will not give up. So we have to fight. Our fighting has to continue. My last question, before I open up the question and answer to the public here, is let's talk about the political landscape here. So, ICE, they are everywhere, right? ACE has been targeting in the beginning, or maybe now too, like restaurants and subway or churches. But then recently, so therefore, a lot of Latin American population have been affected by that, right? And last week, this ICE went to Georgia, the Hyundai factory, right? And they arrested 500 people and 475 exactly, and 300 were Korean nationals. And they are still being, I think, arrested. And the Korea government was going to send an airplane, which I think is really cool for them to do that. You know, I was very proud of that. But then now they are like still a little bit stuck because they have to have a negotiation whether they are going to be 추방, which is expelled from this country, then they cannot come to America anymore. So they are kind of doing this. But the referee effect is huge. You know, I mean, so I think there's a competing interest here. The Trump administration interest is to revival of the factories, right? But at the same time, in order for you to revive the factories, you need to have illegal immigrants as well. But then they want to get rid of illegal immigrants. So it is very confusing, very contradicting, and there is two interests competing with each other. Now, my question for you is that because of all this political landscape and uncertainty and the fear that is being produced so much, it is affecting Asian American immigrants, of course, other immigrants as well. It's affecting all of us as well, because even if you are citizens, it is affecting you, right? Because of our church members, our neighbors, you know, our children's roommate, they could be impacted by all of this. So we are all being impacted by this ICE. Now, so how do we, you know, so what are some ideas about how these immigrant families and these neighbors or the bystanders, how can we deal with this one? Like, how can we foster the resilience to get through these difficulties? I mean, we may think that this is 3 years, but it could be more than 3 years, depending on how Democrats come together, have a very strong leader, and they show their leadership. So, what would you say?
Do you have 1 hour? So a couple of things I'm thinking about. I'm gonna try to concise it. I don't think I have an answer, and I think part of doing what many of us do is to be able to show that. I mean, no one's alone in here, right? Many of us know that when we're struggling, we feel very alone, and I guess part of what we do. As somebody who's got a little bit more privilege, who's a little bit older, who don't have as many struggles or disabilities, right? Like, if I can do a little bit more for somebody, I'm going to. I'm a new citizen. I think about ICE knocking on my door. I think about what's gonna happen to my 6-year-old if I am deported into a jail somewhere. I spent 2 hours on the couch one day ruminating. Just ruminating. And I was like, what are you doing? And then I go back to my little bubble of, oh, this is a blue state, blah, blah, blah. So that's one thing I wanted to say in response. The other thing I also sort of want to wrap it in, less about ICE, but more about system and more about politics. One thing that always concerns me is insurance. So a lot of my clients, they're young, they are newly in the workforce, they are not going to pay me $300 for private practice. So for some of you who are going to be therapists, here's my pitch. If you could keep yourself on the panel so people can access you, please do so. I don't know what greed is gonna affect insurance company to do. My scary thought is they're going to stop paying or reimbursing for mental health services. So those are my crazy thoughts, but if I could do a pitch here for many of you who are, please try to say, if I won't pay my own therapist $200 to see her, I'm not gonna ask somebody to pay me $200 to see me.
So
I think I want to talk about this from the angle of funding, just because we're a government-funded organization, and so we receive federal and also state pass-through funding. And so one of the things that we've been very mindful of, and I don't know if this touches upon anybody else in their organizations, are the contract conditions. There are the contract conditions right now that folks need to sign up to are anti-DEI contract conditions that align with the current administration's political agenda. And that's something that there are multiple coalitions working on with lawsuits in order to stop, and some have been stopped, but that's something that I think folks should be very mindful of in what they're signing up for, and making sure to read what they're being asked to do and how that could affect them. Signing up could mean that you get closer to an audit, and there are a lot of executive orders there that are pretty scary. Anyway, just wanted to put that out there. One of the things that I think folks can do is really policy advocacy. There are a lot of policies and work that's being done at the legislative level that I think are important, that do need folks to advocate on. Things like Dignity Not Deportation, Safe Communities Act, the Language Access and Inclusion Bill. When thinking about domestic violence, I'm thinking about the, oh gosh, now I can't remember the name of it, abusive litigation. And so there are things that we can do around this. The Attorney General's office is also asking, what are you seeing on the ground? Because they want to know how they can help as well and how they can get involved. So I think these are the ways that I'd sort of look at this and how we can sort of approach it, because it does feel like a lack of control and helplessness. At least that's how I felt as a leader in a nonprofit organization. So I'm always trying to think about, well, how can we do something about this? Anyway, thank you.
Yeah, I think, bottom line is get involved wherever you can, right? And at whatever level you feel most comfortable with, because let's be realistic here, sometimes it is a privilege to be able to say, hey, I'm gonna go walk down Beacon Street and protest with like 30,000 other people. Some folks may not feel safe, and it may not even be safe, right? Like, there's a lot of talk about people being planted in a number of these protests and marches, ensuring that you don't stir anything up so that something goes sideways. But yeah, I do think that it's really incredibly important to get involved, however you define that. And I don't think it just has to be advocacy or legally related. I think it's incredibly important in these uncertain times to find community bonds. So even going out and volunteering with a nonprofit organization, or getting involved in a local, I don't know, kickball league or something. Being able to build community is really important. And so I would highly encourage that as well. But that all being said, I think there's so much value in ensuring that we acknowledge and name what's going on too. I think what is happening at the federal level as it relates to a number of the policies that are coming out and have come out, there is this initiative to really erase our own existence from the map. And I think for us to really address or even combat that, we can only really do it together. So get involved, and hopefully we'll see you at some of our community events.
That's great, thank you. So we're gonna open up question and answer session here. So if you have any questions or comments that you want to make.
You're the first, and then you will be next.
Hi, my name is Monica. I'm currently working in psychiatry, interested primarily in college-age students. And first of all, thank you so much for sharing such great life experiences and also just insight into so many different avenues within mental health within our population. You mentioned a little bit about how possibly more removed you are from the first gen, or first immigrant generation, that things might get better, or I guess some of the races, that's a weird way to put it, but you mentioned how some of the trauma newer generations might bring in new perspectives that might make things better. But I was wondering, because Dr. Lee had mentioned working with some international student populations as well, what kind of issues might be seen more from students who come directly from like Asian countries, and what kind of, because those might not directly be due to a compounded experience with racism while living in America, and what kind of experiences come from the mainland perhaps that intertwines with racism experienced in this country, and how that affects our incoming new Asian community members.
So what we often, at least I can speak for my experience so far, is many of them, when they end up coming in for services, and if we sort of listen to the stories, it very inherently turns into a parent-child traumatic struggles. So, you know, students who are highly anxious, believing that they need to be doing a really good job, they need to always be studying, they need to be getting good grades, they feel like, I think a lot of times is that they are so far away from home, they know that they are having a lot of struggles, they know how to come in for help, but then it kind of stops there. Then there's a block, and it almost feels like, okay, I don't know what to do next. I don't know what is next. So even in conversation around what are you feeling, like that concept has to get taught to them, right? Like you are allowed to feel sad, right? You're crying. No, I'm just overwhelmed, or you know, some version of that. So sort of in my work, it's like sort of relating to like something bad happened in your life that is making it hard for you to succeed here, that's making it hard for you to adjust, right? And our work together is to try to figure out what it is that has gone wrong, so you can start making certain connections, building awareness and insight, and then that can slowly lead to convincing them. So almost feels like you need to convince them that they can get help, coping skills can help, medicine can help, providing information about medication. Sometimes they just blindly think that it's okay. They blindly think that you're the expert, so therefore you're giving them the right meds, but we all know that some certain medication doesn't affect Asian population the same way as it does for, you know, whatever the research was on the population. So does that kind of answer your question?
Our break will start at 3:20.
Sorry, I'll just add like a quick follow-up question to that, if that's okay. Would that be okay, or?
I guess.
Okay. In that case, would you say that the parents, or the relationship that the kids have with the parents, is the crux of?
It's sort of, I don't want to use the word crux, but I would say that most often, right, we're in the field of never say never. Nothing is absolute, but very often we see that, you know, it's a lot of attachment issues that was broken, a lot of rejection, abandonment, that then affects the person to not feel a good sense of, like, not to have a sense of self, right? And literature does tell us that when you lack a sense of self, a lot of things, you're not as likely to cope. And so therefore, things can spiral easily, and that's how some of these symptoms start showing up. Okay? So, you're welcome.
Any other questions?
Yeah, hi, it's more of a comment and observation. My name is Purnima, and thank you all for your panel discussions today. They've been absolutely phenomenal and great to hear from each and every one of you. As we were addressing trauma and trauma-informed care, I was thinking as an individual therapist who works with individuals, families, and couples, the confluence of the collectivist and the individualistic coming together in first and second generations, where now I am seeing, even in my own practice, so much more estrangement, which comes from, as you know, Colleen was saying, you know, the dynamic endures, and you were talking about the stories that we as immigrants, as Asian immigrants, do not share with our children. We don't tell them about our lived experiences, our traumas, our pains, our troubles, but we want the best for them. And so we try and build our little third world, as I call it, learning from both cultures to give them the best. But we lose something in that transition. And I am starting to see it in my practice with some people where there is now estrangement, and the first, second generation is saying, I'm done. The buck stops here. I'm not interested in repair. My parents have just not been there for me in the ways that I have needed, and so the relationship is severed. So it's an observation and a thought that I'm perplexed about in terms of how do we also address the trauma so that we can have more repair and coming together as opposed to the walking away and separation.
What a great question. I think I'm going to open up the answer to all of you.
If I may add to this, I feel like in today's generation, you see a lot of cancel culture that bleeds into. Ooh. How do I? Sorry.
Hi.
I was just saying that I think, nowadays you see a lot of cancel culture.
Oh,
yeah.
okay.
Usually it works. Hi, my name is Gehenna. We are a small nonprofit out in
And I think I would like to agree with that. I think, the question, as I'm sitting here listening to you, the question I have is, why aren't we being more curious about our parents' stories? Some of the things, oh, sorry, it's gonna bug out on me. Hello? Okay. Yeah, why aren't we more curious about our parents' stories? Now, don't get me wrong, I've asked my parents, both my parents are refugees. My mom came over on a boat in 1979, escaped an island. My dad was one of the last Vietnamese refugees to step on a US plane in 1975, one of the first refugees processed at Camp Pendleton. And I remember asking them, when I was relatively young, probably college age, let's be realistic here, about what was it like? What was it like to come to America, not know the language, with nothing but the clothes on your back? And when my dad came, he was 21. And I remember asking him, when I turned 21, I was like, did you ever think that, this would be it for you? And he said, no. I thought I'd be back in a few years and I'd be back to my social life and it'd be fine. We were just gone and, that was that. But that was the first time that we had that conversation. And I think, at least in my family, there was just so much trauma from the war that no one really wanted to talk about it. And it wasn't until the kids got older and you're decades removed from all of that they started talking about it. And so I always kind of wonder about that, which is why aren't we more curious to hear our family stories? We know that, intergenerational trauma is real. I also want to know how real intergenerational joy is too. What are some of the things that our families are, our parents or grandparents are passing down that I'm, seeing in myself, but I may not have had experience firsthand because I wasn't there. So I hope that that sort of approach and perspective comes back. I do think there's just such incredibly divisive dialogue and conversations happening right now, probably fueled by social media, amongst other things. But I do hold hope that, eventually, hopefully, we're able to come back to that.
I'm going to respond like a therapist. That sounds like a very angry statement. Like sometimes I think about, I know earlier on I talk about anger is powerful, right? Anger allows us to build a wall. And what we're seeing very often is that this wall has gone like 10 feet tall, right? You need enough of a wall to sort of at least give you a little bit of distance. But every time I hear a statement like this, I always ask people, like, can you tell me a little bit about what makes you so angry? Like talk to me about this anger, because that is a very angry statement. I'm not trying to talk you out of, what you believe you want to do, but I'm just really curious where this is coming from or what this represents for you.
Yes, I see both hands. Okay, you go first and then two, three.
Okay. Oh. Okay, you go first, and then you are the last one.
Thank you. So my question is, well, before I'm starting with my question, I actually have a context. When we talk about trauma-informed care, we think about someone in the front line helping a client who are suffering from trauma to get access to health care. But now I want to think it's reversely. Thinking about we are the one who offering that care, and sometimes because we care, because we're passionate about our work, we actually co-experience or pick up that trauma while helping the client seeking help. So I wonder if the four of you has seen it throughout the work that you do, and how has the healing journey been for maybe your teammates, colleagues, friend, family, community health worker, etc.
So you just made me tired with that question. Yeah. So no, that's something that we think a lot about because we work with victims of trauma, and our staff feel it. And it's very intense work, especially intense work when you don't get the support, you can't leverage mainstream services, it's all on you. So that's something that we talk about a lot. And I think the ways that we've tried to be creative around is one, of course, offering, if folks want mental health services, then of course to seek it, and we'll also support it through our organization. But then also it's been about really paying attention to our staff and really paying attention to what, say for example, this current climate is doing to them. Like how do we put safety measures in place for them? What do they need? But then also just, we have a pretty attentive staff to where they're also looking at the people who they supervise, and they're noticing too, because we're all pretty close at the organization, and noticing too where they look like they're burnt out, and really having that conversation saying, hey, it looks like you need some time. Or do you want to take some time or an extended amount of time? We've also extended vacations. We have a very extensive vacation timeout period. So I think we're really mindful of that, and we're also really mindful of like things such as getting together. Being in community together, especially for an organization that works remotely, has been incredibly important. And so we have designated meetings, and we actually have an all-staff meeting next week, I think. Is it next week? It is right next week. I'm looking at my staff. And but those moments are fun because we get to laugh, and we get to reminisce, we get to talk about things that we wouldn't be able to talk about outside of work. So I think those have been the things that have been important for us. Yeah, so I'm gonna stop there and pass on.
Thank you. Once again, I would talk really quick. I wanted to go back to what Chris said, as well as I love the question on estrangement and the earlier question too, and wanted to tie them together a little bit. It was really intriguing when you said that, okay, the Koreans are doing well and Korean Americans are not, just as you were, Monica, you were saying. And I started thinking about the social context, right? And if you would know, a lot of times the people who are in leadership positions And, you know, Toru, Chris, you're from Korea, you're from Japan. I'm from Hong Kong, although I came much earlier than you. And whenever I see that, I always guess, oh, this person's from Hawaii. And like 7 out of 10 times I'm right. How do I know that that person who is Asian American, who's in leadership is in Hawaii, from Hawaii? Because in Hawaii, they're the majority. Those are the people who rise to leadership because they've never experienced being in a marginalized position. And I lived in Hawaii for 8 years doing my graduate degree. And I thought to myself, every Asian American needs to live in Hawaii at least for a little while. And you can experience what it's like for other people to adapt to your mores and your values and your, you know, culture of socialization. And so, you know, as a parent, and you guys are parents as well, sometimes we do think, I think a lot of us from not, you know, from Asian America our whole lives, we think, oh my God, they're so fragile, aren't they? Really, tell the truth, right? It's like, oh God, this younger generation, they're so fragile. And it's because they are in this culture where they're constantly minoritized. And so I want to go back to the estrangement and, you know, what Aileen said as well is, okay, so they come to therapy and, you know, you might want to advise them, how do I tell my parents that you don't understand me, you know, you piss me off and all of that stuff. And I would start with, you know, in terms of the estrangement is, and Colleen, you said that too, is ask them about them. You know, don't tell them about you. I know it's hard to say that to young people who are self-obsessed at that time, but, and even if they don't talk about themselves, you yourself can, I mean, as a young person can learn about the history of the group. You know, like I never took Asian American history, you know, and I just learned it on my own, and the Chinese Exclusion Act and all of that stuff. And then you can apply it to your parents' lives, right? Like, you know, the Korean comfort women and the, you know, internment of the of Japanese Americans and so forth, and start applying to them because they're not going to talk about it, but we're the generation that would talk about it. So it's kind of like reversing the estrangement, if you will, because we do live in a culture of estrangement with younger people, but you have to bridge that gap somehow. And Pata and I had a really interesting conversation at lunch too about how art can do that, because art is, you know, it fills that gap. So I don't have a question. Those are just like my thoughts tying everything. And, you know, I found that you guys are really up on, you know, what's current, like the estrangement is current and cancel culture is current. And I'm so glad you talked about, you know, LGBT communities as well, because that's, you know, there's a lot of issues at the challenges there. So thank you.
What a beautiful way of wrapping up. Thank you.
Thank you. Do you have anything that you want to say?
No, this is a really fruitful and very insightful, productive conversation that we may have that thoughts, but it disappears a lot of times. But we feel like we collect all those thoughts and feelings and questions. We put it together and we were like chewing it for a long time. That's how I feel like. So thank you so much for coming here. Thank you so much for sticking with us. Thank you.
Thank you again.